Hi guys, so we're doing paper 7 now. So this is the last paper for the PD final exam. Finally, we got to the end. So, okay, paper 7, we need to do neck examination. So this is part of the HEENT exam. So we need to examine trachea and the thyroid gland, including inspection, palpation, and auscultation. So starting with the trachea. So the first thing that we need to inspect is if it's in the midline, which it should be. So like things that may cause it to deviate from the midline include like if there's a mass, like a cancerous lesion growing in the neck, or if there's a large pneumothorax in the lung. And we also look at any like obvious swelling, any redness, any asymmetries. I think that's it for inspection. And then for the palpation of the trachea, we palpate the space between the trachea and the sternocleidomastoid on both sides, and they should be symmetrical. Okay. I think that's. Oh, also we can auscultate the trachea for breath sounds. So tracheal sounds are often higher in pitch anyway compared to normal vesicular sounds. We can also count the respiration rate this way if we haven't done so already, if we're performing like a respiratory exam. Okay, so moving on to thyroid gland examination, we start again with inspection. So we inspect the area below the cricoid cartilage where the thyroid gland is located, and we look for things like symmetry, any obvious swelling, redness, any lesions, any enlargement of the thyroid gland. And then we can use tangential lighting directed from the patient's from the tip of the patient's chin, directed downwards to help us visualize the contour of the thyroid gland, as well as like the borders of the thyroid gland. And then finally, for inspection, we could observe the patient as they swallow. So we ask the patient to take a sip of water, tilt their head back slightly, and swallow the water. And what we should have observed is the upward movement of the thyroid isthmus or the thyroid gland as the patient swallows water. For the palpation of the thyroid gland, we can start in front of the patient. So we can palpate some of the landmarks, so including the notched thyroid cartilage and the cricoid cartilage just below it. And the thyroid gland is below the cricoid cartilage. And we feel for like the enlargement of the gland. And then we go behind the patient and we kind of like place our fingers around the neck so that our index finger is just below the cricoid cartilage. And what we do is we ask the patient to again take a sip of water and then swallow, and we feel for the movement of the thyroid isthmus up as the patient swallows, and it should go back down after swallowing. Another one for palpation is we can displace the trachea to one side. So we can basically displace the trachea to the right by pushing the trachea with our left fingers, and then feel the right lobe of the thyroid gland. Okay, and then we can do the same with the other side. So we can displace the trachea to the left side by pushing it with our right fingers and feel the left lobe of the thyroid gland. And we're feeling for things like the size, the shape, its consistency, any nodules, enlargement, and any tenderness in the nodes. So if we see and feel enlargement in the thyroid gland, we can auscultate the thyroid, the lateral lobes of the thyroid gland to we can auscultate the lateral lobes of the thyroid gland for like bruits of non-cardiac origin, which can often be seen in like hyperthyroidism. Okay, so I think that's it for trachea and thyroid gland examination. And then the next one is heart examination. So we need to do precordium inspection, palpation, and auscultation, which I have done in other papers. So just please watch that. The nervous system is next. We need to examine cranial nerves 9 and 10. Right, so cranial nerve 9 is the glossopharyngeal nerve, and cranial nerve 10 is the vagus nerve. So these nerves, they mediate the motor and sensory functions of our soft palate, our pharynx, and our larynx. So firstly, what we need to do is we need to listen to the patient as the patient speaks, to detect any hoarseness in the patient's voice. And hoarseness indicates paralysis of the vocal cords. And if the patient's voice has like a nasal quality, then this may indicate paralysis of the palate. And we ask the patient if they experience any difficulty in swallowing, which can be due to pharyngeal weakness. Okay, so again, problem with the nerves. And then we ask the patient to say ah or to yawn, so we can visualize the soft palate and the uvula. So the tongue might get in the way, so we can use a tongue depressor to depress the tongue and ask the patient to say ah, so we see the movement of the soft palate and the uvula. So when the patient says ah, what should happen is that the uvula should rise symmetrically, and the soft palate should rise symmetrically, and the uvula should remain in the midline. If there is bilateral lesion in vagus nerve, so cranial nerve 10, this means that the soft palate would not rise at all. So it just would fail to rise. If there's unilateral lesion in cranial nerve 10, the soft palate, so the uvula would be pulled towards the normal side of the soft palate and therefore point towards the side of the lesion. Okay, so for instance, this we have like a unilateral lesion affecting this side, and this side's normal, and the uvula is here. So the soft palate here would rise, and it would pull the uvula with it. So therefore, the uvula would point away from the side of the lesion. So that's how you can tell. And then after that, we can also observe the movement of the posterior pharynx. So the posterior pharynx, when the patient says ah, they should move medially like a curtain. The final thing is testing for the patient's gag reflex. So you need to warn the patient first that you're gonna test for the gag reflex, because this may be uncomfortable for the patient. And they might even say no to this test. So basically, what this involves is you can get 2 tongue depressors, one to depress the tongue so you could clearly see the back of the throat, and using the other tongue depressor, stimulate the back of the throat in turn to check for the gag reflex. Okay, I think that's it for cranial nerves 9 and 10. So the next one is respiratory system. So we have to inspect the anterior chest, palpate, percuss, and auscultate, which I think I have done in other videos as well. So this is it for paper 7.